Restless legs syndrome (RLS) is a condition in which you have an uncontrollable urge to move your legs, usually due to leg discomfort. It typically happens in the evenings or nights while you're sitting or lying down. Moving eases the unpleasant feeling temporarily. Restless legs syndrome, now known as restless legs syndrome, Willis-Ekbom disease (RLS-WED), can begin at any age and generally worsens as you age. It can disrupt sleep, leading to daytime drowsiness and make traveling difficult. Simple self-care steps and lifestyle changes may help you. Medications also help many people with restless legs syndrome. Symptoms. The compelling desire to move is what gives restless legs syndrome its name. Common characteristics of RLS signs and symptoms include: sensation starts after being at rest. The sensation typically begins after you've been lying down or sitting for an extended time, such as in a car, airplane or movie theater. Relief by movement. The sensation of RLS-WED lessens with movement, such as stretching, jiggling your legs, pacing or walking. Worsening of symptoms in the evening. Symptoms occur mainly at night. Nighttime leg twitching. RLS-WED may be associated with another, more common condition called periodic limb movement of sleep, which causes your legs to twitch and kick, possibly throughout the night, while you sleep. People typically describe restless legs syndrome symptoms as abnormal, unpleasant sensations in their legs or feet, usually on both sides of the body. Less commonly, the sensations affect the arms. The sensations, which generally occur within the limb rather than on the skin, are described as crawling, creeping, pulling, throbbing, aching, itching. Causes. Often, there's no known cause for restless legs syndrome. Researchers suspect the condition may be due to an imbalance of the brain chemical dopamine, which sends messages to control muscle movement. Heredity. Sometimes RLS-WED runs in families, especially if the condition starts before age 50. Researchers have identified sites on the chromosomes where genes for RLS-WED may be present. Pregnancy. Pregnancy or hormonal changes may temporarily worsen RLS-WED signs and symptoms. Some women get RLS-WED for the first time during pregnancy, especially during their last trimester. However, signs and symptoms usually disappear after delivery. Risk factors. RLS-WED can develop at any age, even during childhood. The disorder is more common with increasing age and more common in women than in men. Restless legs syndrome usually isn't related to a serious underlying medical problem. However, RLS-WED sometimes accompanies other conditions such as peripheral neuropathy. This damage to the nerves in your hands and feet is sometimes due to chronic diseases such as diabetes and alcoholism. Iron deficiency. Even without anemia, iron deficiency can cause or worsen RLS-WED. If you have a history of bleeding from your stomach or bowels, experience heavy menstrual periods or repeatedly donate blood, you may have iron deficiency. Kidney failure. If you have kidney failure, you may also have iron deficiency, often with anemia. When kidneys don't function properly, iron stores in your blood can decrease. This, with other changes in body chemistry, may cause or worsen RLS-WED. Complications. Although restless legs syndrome, Willis-Ekbom disease (RLS-WED) doesn't lead to other serious conditions, symptoms can range from barely bothersome to incapacitating. Many people with RLS-WED find it difficult to fall or stay asleep. Severe RLS-WED can cause marked impairment in life quality and can result in depression. Insomnia may lead to excessive daytime drowsiness, but RLS-WED may prevent you from daytime napping. Tests and diagnosis. Your doctor will take your medical history and ask for a description of your symptoms. A diagnosis of RLS-WED is based on the following criteria, established by the International Restless Legs Syndrome Study Group. You have a strong, often irresistible urge to move your legs, usually accompanied by uncomfortable sensations typically described as crawling, creeping, cramping, tingling or pulling. Your symptoms start or get worse when you're resting, such as sitting or lying down. Your symptoms are partially or temporarily relieved by activity, such as walking or stretching. Your symptoms are worse at night. Symptoms can't be explained solely by another medical or behavioral condition. Your doctor may conduct a physical and a neurological exam. Blood tests, particularly for iron deficiency, may be ordered to exclude other possible causes for your symptoms. In addition, your doctor may refer you to a sleep specialist. This may involve an overnight stay at a sleep clinic, where doctors can study your sleep if another sleep disorder such as sleep apnea is suspected. However, a diagnosis of RLS-WED usually doesn't require a sleep study. Treatments and drugs. Sometimes, treating an underlying condition, such as iron deficiency, greatly relieves symptoms of restless legs syndrome. Correcting an iron deficiency may involve taking iron supplements. However, take iron supplements only with medical supervision and after your doctor has checked your blood iron level. If you have RLS-WED without an associated condition, treatment focuses on lifestyle changes and if those aren't effective, medications. Medication therapy. Medications that increase dopamine in the brain. These medications reduce motion in your legs by affecting the level of the chemical messenger dopamine in your brain. Ropenetrol, Requaprotigatine, Nupro, and Pramipexole, Mirapex are approved by the Food and Drug Administration for the treatment of moderate to severe RLS. Drugs affecting calcium channels. Certain medications such as gabapentin, Neurontin, and pregabalin, Lyrica work for some people with RLS. Opioids. Narcotic medications can relieve mild to severe symptoms, but they may be addicting if used in high doses. Some examples of these medications include codeine, oxycodone, OxyContin, roxicodone, combined oxycodone and acetaminophen, Percocet, Roxicate, and combined hydrocodone and acetaminophen, Norco. Muscle relaxants and sleep medications. This class of medications, known as benzodiazepines, helps you sleep better at night, but they don't eliminate the leg sensations and they may cause daytime drowsiness. Commonly used sedatives for RLS include clonazepam, Klonopin, Esopiclone, Lunesta, Temazepam, Restoril, Zaleplon, Sonata, and Zolpidem, Ambien. Lifestyle and home remedies. Making simple lifestyle changes can help alleviate symptoms of restless legs syndrome. Try baths and massages. Soaking in a warm bath and massaging your legs can relax your muscles. Apply warm or cool packs. Use of heat or cold or alternating use of the two may lessen your limb sensations. Try relaxation techniques such as meditation or yoga. Stress can aggravate RLS. Learn to relax, especially before bedtime. Establish good sleep hygiene. Fatigue tends to worsen symptoms of RLS, so it's important that you practice good sleep hygiene. Exercise. Getting moderate, regular exercise may relieve symptoms of restless legs syndrome. Avoid caffeine. Sometimes cutting back on caffeine may help restless legs. Try to avoid caffeine-containing products, including chocolate and caffeinated beverages, such as coffee, tea, and soft drinks, for a few weeks to see if this helps.